Early complications of TAR, kind of excluding infection. I think there'll still be a little bit of overlap with some of the longer-term complications. But I went a little long yesterday. I'll try to keep it shorter so we can get to cases and pearls, which I think are always the best part of these types of courses. So what are early complications of TAR? I mean, it starts at pre-op with your anesthesiologist, nerve block related. We talked a little bit about that yesterday. Intra-op complications. As I was putting some of these slides or finishing them up this morning, maybe it's because I just didn't have breakfast, but I'll show you some pictures from some of these studies that I just kind of went over. It makes you kind of nauseous to think what wires can do. It's not just saw blades. Nerve, artery, tendon laceration, and injuries. I think a lot of these just get missed, or just get overlooked, or, oh, that's, give it a year, it's going to get better. I think we don't know a lot about that. Periprosthetic fractures, whether they're intra-op or post-op. Acute blood loss, not a huge thing with us. We work with a tourniquet, but and a lot of us are incorporating TXA into our practices as well. In terms of post-op, what's considered early and late? Is it 30 days, 90 days? Is it the first couple of years? I tried to kind of pick and choose articles on that. Wounds, soft tissue failure, obviously everything Evan talked about, acute and chronic infection. I mean, I think in terms of that, I feel like that's something our generation is going to have to figure out. Like, quit leaning on hip and knee folks. Try to use larger institutions and multi-center studies to try to glean what are our numbers for acute and chronic infection. I think that's going to help us out a lot because, as we saw, all those curves are going up as primaries go up, revisions go up, and revisions for infection go up. I'll talk about fracture. CRPS, kind of rare, but probably more common, a little bit of neuritis.